If you have an abnormal lipid panel, that means all the indices are elevated. Triglycerides, cholesterol, LDL, HDL is low, the ratio is high, and your provider and you have tried lifestyle modifications, you've been not successful at it, they started you on statins, particularly high intensity statins, and you read online on Google or you hear somebody talk about statins online in a negative way, and you decide to stop taking your statin medication, please let your primary care provider know or your cardiologist, whoever started you on that medication. Let them know that you stopped taking it. That way, they document that you're not taking it. That way, if someone found you on the street, you've passed out from a heart attack, right? If you had a heart attack or you showed up in the ER with severe chest pain and you're actively having a heart attack, that they know that you stopped taking the statin medication. Because it looks bad on paper that you have a high intensity statin prescribed to you, but then you're showing up with a heart attack. But then nobody would know the backstory that you stopped taking the medication. Those are meant to prevent cardiovascular disease risks like heart attack, strokes, and death, right? So if you decide, like, oh, I read on Google and they said statins are bad, oh, statins cause yada, 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 so I stopped taking it, let your provider know, courtesy, please, okay? All they need to do is just document that you made an informed decision to stop taking it. That's all. That's not to say that you cannot be on a statin and still have a heart attack. But then it's bad if you had a risk factor. If your ASCVD risk was elevated, they started you on a statin and then you stopped taking the statin and then you had a heart attack. That's what I'm really particularly concerned about. It can still happen, right? Even people that have normal lipid panels still have heart attacks, right? But for those that are proactively going to see a primary care provider, they're trying to be proactive with their health and they have a statin prescribed to them and they decide to stop taking it, just let the provider know. That's all. Just let us know.